Understanding Behavior. That's me. I'm Jan Robson, Provincial Education Coordinator at the Alzheimer Society of BC. And this is our afternoon's agenda. We'll be talking about types of reactive behaviors, and I'll define what that is, but that's what we commonly refer to as aggression, violence, that kind of thing. We'll be looking at that. We'll be looking at the causes for some of these behaviors, communication strategies that can handle situations that you maybe find a little challenging. Prevention, and I think prevention may be a hopeful word, but what can we do to perhaps stave off some of these difficulties at least a bit? And then we'll be working through a fictional scenario and looking at some of the steps you can take if you're experiencing a behavior on a fairly regular basis that you really don't know how to deal with. How can you start to maybe analyze it and see about different strategies that might help? This is the third workshop in kind of the core. We had last month Understanding Communication, the month before was Understanding Dementia, and these really form the core information that's so helpful as far as getting a little bit of a handle on what is this thing called dementia, how can I communicate with my family member in a better way, and how can I understand some of the behavior they're exhibiting. So this is the third of the three. The types of reactive behaviors. Now, as the term implies, reactive means that the person is reacting to things that are going on. Another term that's often used is responsive behaviors. They're responding to what you're doing or saying. They're reacting or responding also as well to the things that are going on within them. Often what we term reactive behaviors are really the person's attempt to communicate when they are at a point where the verbal communication is not working so well. So verbally, reactive behaviors can take the form of yelling, and that doesn't even have to be specific words. Yelling, screaming, abusive language, swearing. Interestingly enough, and we mentioned this in the Understanding Dementia workshop, one of the types of things that tends to hang on as dementia makes its way throughout the brain and causes damage throughout the brain, one of the types of language, if you want to call it that tends to hang on for a while is the nasty language, the swear words. And this can be very much true for the person who really never used those words before they became ill. So you've got the person who was, quite mild-mannered and swear words, oh, no, don't say swear words. You might find that those words manage to find their way out now. And so these can show themselves in terms of reacting to what's going on. Also important to keep in mind that what we're talking about is a change. So it's a change from what happened in the past. So if the person has always been very abusive and yelling, screaming, that kind of thing, I'm not sure we would really call that reactive behaviors. That's their personality, unfortunately. We're talking, as with so many of the changes that go along with Alzheimer's and other dementias, we're talking a change from the pre-dementia behavior. Then there's the physically reactive behaviors. For example, resisting care. So you're trying to help the person get their grooming done, change their clothes, and they're pushing away. They're resisting all of your attempts to help. Throwing objects, damaging property, scratching, pinching, pushing, kicking, hitting, spitting, all of those kinds of things can happen in a reaction to things that are going on. So what are the causes? Well, first and foremost, we're talking about diseases of the brain. We're talking about diseases that cause brain damage. And again, if you participated in the Understanding Dementia tele-workshop, we had a picture of how much the brain changes over time with Alzheimer's disease, where it shrinks overall, and also there's increasing gaps within the brain tissue. So just that brain damage itself, people are trying to communicate, and there's so many gaps in their brain and their brain's ability to transmit messages that it's not surprising that they may lash out as a result of attempts to communicate that are not being very successful. So again, attempts to communicate. Some of the causes are reacting to physical symptoms, reacting to the environment, reacting to their feelings. So we'll go into that in a little bit more detail. So the physical symptoms, the reactive behavior may be in response and reaction to something as simple as constipation. Studies have shown that in terms of the so-called violence, the aggression, what we prefer to call reactive behaviors, when a person is in care, constipation is one of the top 4 reasons for those behaviors. So, to be absolutely blunt, the person can't poop and they can't tell you how uncomfortable they are, and they lash out in some way, whether that's by screaming or whether that's by pushing you away or kicking you when you come to change them, all sorts of different possibilities. Now, of course, this would be later in the disease. One of the things that we talked about with communication last month is that, there's the progression of it. And when behavior starts to be the main mode, if you want, of communication, the person is progressing. The person is farther along in the disease. If they're still early enough that they can articulate what's going on, oh, I feel terrible, I haven't gone to the bathroom in 4 days, that kind of thing, they're not as likely to lash out. It's when that type of communication becomes more and more challenging for them that the lashing out happens. Discomfort in so many different ways. It can be discomfort from perhaps being in a wheelchair and just, being really uncomfortable. It can be discomfort from various physical causes, arthritis, that kind of thing. It can be new medication that they've got that dries their mouth out, and so if they have dentures, they rub. And so that kind of discomfort, particularly if they're trying to eat. So many possibilities in terms of discomfort. Pain of whatever for origin. Fever, hunger, thirst, fatigue. Fatigue's an important one because when you're talking about a disease like Alzheimer's disease, it's hard work trying to communicate. It's this really constant hard work to understand and to be understood. And people do get very fatigued. And so that's not surprising that might be one of the physical symptoms that lead to a person lashing out. The environment can be a cause of reactive behaviors. Is it too noisy? Are there too many people around? Too much activity, a high level of stress? Generally speaking, as dementia progresses, more and more simplicity is more conducive to the person having more calm in their life. So, reducing clutter, that kind of thing. And often when we're talking about group living situations, for example, a person being in care, a lot of the activities that are done they're group activities, there's people around, there's noise, there's music, there's maybe crafts, that kind of thing. So it's not surprising that sometimes in those situations the person may react in a way that's not terribly positive. The reactive behavior may be in reaction to their own feelings. They're anxious, fearful, frustrated, depressed. How frustrating it would be to be trying to understand what's going on around you and not be able to figure it out, to be trying to articulate something and not be able to find the words, where you're, that kind of thing, where the words just aren't coming or the names aren't coming, and always trying to dig back to find those memories that just don't seem to be there, or people are telling you about things that happened and you have no recollection of them, and you may be very depressed about that. You may be very agitated about that. Why are you lying to me? That never happened. I'm sure that never happened. I never went to Spain. I've never been to Spain in my life, when in fact they have. So, not surprising that there's a lot of frustration, fear. As you feel your sense of control, personal control over yourself, what you can say, what you can do, what you have agency over. Be very scary as you feel that slipping away. But one of the things that we talked about last month with communication was, was that when we're trying to communicate feelings and attitudes, the good news story is that studies have shown that words themselves, the content of the words themselves, are not terribly important. When we're communicating feelings and attitudes, body language is big. 55%, one study showed, of our communication of feelings is through body language. And think about it, you know, a warm hug says way more than yapping away about how much I care for you and I really like you in my life and, you know, that kind of thing. A warm hug says so much. 38%, pitch and tone of voice. Again, the way we say words. And so that's also hopeful, because if the person is not specifically understanding what that word means, but you're saying it with warmth, with kindness, with love, with care, that kind of thing gets communicated, even if the actual content of the words doesn't mean much to the person. So communication, as words become less and less useful currency, or at least the content of words become less and less useful for the person, we can still communicate on a feeling level with how we say those words, how our words sound, and the package that we deliver them in. Improving communication, we talked about this last time. This is just a quick overview, demonstrating if the person increasingly has a hard time understanding what you're saying, say something and show at the same time. So would you like a cup of coffee? So ask those words, but also hold up a mug. Or if there's coffee in that mug, you know, run it under their nose so they smell it. So more cues. Expressing feelings with your body. And expressing them honestly with your body. Because sometimes what happens is we get so caught up in other things that are going on. So if you're a full-time caregiver, you are doing the things around the house that you've always done. You're doing many, or perhaps at this point all, of the things that your spouse or your parent has done as well in the past. You may be trying to work. You may be trying to maintain some friendships. You may have children, all of those things that go into a life. You may, as the caregiver, as the care partner, be very stressed. And so you may be trying to communicate warmth with your voice, but if you're doing it where you're really stressed and uptight, you know, the tight muscles, the tense muscles, that's what's going to be communicated more than what the words actually say. So that warm tone of voice, making eye contact, taking your time when you communicate, because the person increasingly will need to, messages in the brain will need to find detours, and that takes time. Repeating, they don't get it the first time. Repeating, always indicate that you're listening, one message at a time, paying attention to how you deliver the message, but also what kind of body language is coming from them. And always being reassuring. It's scary when your brain is not cooperating. It's very scary. Any of you who have had periods of time where you felt quite befuddled due to something perhaps like coming down off anesthetic, or for some people when they've had cancer treatments, you know, there's chemo brain, that the brain feels that much more befuddled. Going through menopause, for some women going through menopause, they really feel like they're losing it in terms of their cognitive capacity for a period of time. So if you've ever, for a period of time, gone through that where you're really feeling like you're losing your grip as far as your cognitive capabilities, you'll understand that reassurance for the person with dementia is so important. Keep it short and simple in your communication with the person. And then helpful strategies with communication, paying attention to warning signs. So as you know the person well, if you are the family caregiver, and one of the things that's important is using what you know to better stave off difficulties. So warning signs. You may find if the person in your life is increasingly communicating through behavior, you may find that when they've had a bad day, they start to get very restless first. Before they, throw the utensils or whatever the situation is, they start getting very agitated and they start pacing. That's good information. That's a warning sign. And if you see the person starting to pace, you know that it would make sense for both of you to intervene at that point and stave off potentially some difficulties. Avoiding stressful situations. The big, noisy restaurant where kids are yelling and there's, carts crashing and this kind of thing, probably not the best bet. The huge, big family dinners, and this is something that can be really tough for people, particularly as we near the holiday season. Wanting to do what you've always done as far as family gatherings and having the 25 relatives over for brunch may not be the best bet. Noting the effect of the environment on the person. Ensuring that their personal space is respected. And as you're increasingly providing care for a person, it's so easy to cross that line in terms of personal space because you have to cross it regularly to provide care. But making sure that when that care is provided that you're pulling back and allowing that person to have their own personal space. Watching for their level of comfort and pain. Pain can be a difficult one to assess as people become less and less able to articulate things verbally. And it becomes a matter of, watching their facial expressions. Often it'll be the wincing. Are they, rubbing their shoulder? They're not saying I have a sore shoulder, but you notice that they're guarding it a lot. Are they pulling back? Are they showing signs that would indicate to you that something is wrong? That may be pain talking there. Again, that reassurance, providing reassurance, avoiding overwhelming tasks. As a person is moving into and beyond the mid-stages of dementia, that's not the time to teach them how to use a computer if they've never used one. Avoiding confrontation. One of the things we discussed last month is avoiding the arguing because, I know I'm right. I picked up Mom's medication yesterday, and yet Mom's saying, no, you didn't give me the medication. And it's so easy then to get pulled into that argument. Doing mild exercise regularly. It's not going to prevent all problems, but certainly exercise is a way for you as the caregiver and for the person with dementia to get rid of some of that stress and tension and have a lot more calm and able to deal with things better. So we're going to go through a 4-step problem-solving situation using a fictional couple. And we'll look at a way, if you've got behaviors that are happening more and more on a regular basis and you don't know what to do, this is a way to maybe look at them and try and figure out what's going on. Now, you're not going to sit there with pen and paper and go through number 1, 2, 3, 4. Chances are some people are very organized and may do that. But this is at least a way to think when you've got a problem, how can I go about this? First step, of course, what is the problem? Defining very clearly what's going on that's problematic. And truly, is it a problem? Because sometimes some of the things that we initially knee-jerk define as problems, really, they're my problem. So for example, if my dad insists on wearing his purple t-shirt that has a big bleach stain on it because it's his favorite shirt and he loves it, and I think, he's got 30 other shirts in the cupboard that look way better than that, but no, he's digging in his heels and we're going out for lunch and he's wearing that purple t-shirt, whose problem is it? And honestly, that would be mine. And so, being real honest about, is it a problem that actually needs to be addressed? So what? Think of it as the so what test. Analyzing the situation, thinking of several possible solutions, because the reality is you might pick a solution that works really well today and it doesn't work so well tomorrow. So the more things you've thought of, the more possibilities you will have when the perfect solution of today is not so perfect tomorrow. And then trying them out. So we'll use the story of George and Mary. George is a 75-year-old man in the middle stage of dementia. Most people would describe him as easygoing, including Mary. He likes helping Mary around the house and watching his favorite show on TV, Wheel of Fortune. Even though George's ability to express himself verbally is diminished, he still enjoys meeting their friends at their favorite coffee bar. For the past 6 months, George has been increasingly agitated at lunchtime. Recently, there have been a few occasions where he was verbally abusive to Mary, and he even pushed her a few times. This is very out of character for George. Mary noticed that George's behavior started to change shortly after they began having their meals delivered at home, just before lunch. So right off the bat, she's thinking, okay, there's been a change in behavior. What's going on? Only when we started to get the meals delivered. So defining the problem, what do you want to change? So that, again, is being honest about whether it's necessary. Is it behavior that can be changed? So, sometimes maybe you would like to change the fact that the person can't understand language very much anymore. Can't do too much about that, unfortunately. Are you willing to spend some time on it? And what do you actually want to achieve? So, being honest about, we're at point A, what would point B look like? In Mary's case, her goal is to stop, or at least diminish, George's verbally and physically aggressive behavior. This is likely possible since George is calm the rest of the time. It's just that lunchtime period that's problematic or has become problematic. And Mary is willing to invest the time and energy to improve the situation. So then the next step, analyzing the situation. Where is it happening? When does it occur? W5. Who is involved or affected? What emotions are being expressed? And why is it happening? Going back to George and Mary. Analyzing the situation, well, the behavior happens just before lunchtime. That's the when. The closer it is to the meal delivery time, the more tense George becomes. The dog barks when the meal delivery person rings the doorbell, and this seems to surprise George and makes him very tense. So we've got a stranger coming to the door, we've got the dog barking, the buzzer at the front door, and he's getting more tense. When the delivery person enters the house, George becomes even more tense and will not move from where he was sitting or interact with anyone. It was at that point last week that George threw his fork against the wall. So he becomes kind of frozen. He's tense from the doorbell and the person coming in, and it's just before lunchtime. You might assume there's a little bit of hunger working there as well. And then when the person comes in the house, he's kind of frozen. But last week he threw a fork when he felt like that. Even though George seems to be angry, so she's trying to figure what the emotions are here. Throwing a fork, the obvious assumption is anger, but Mary thinks that he's mostly afraid. And the anger might be a manifestation of his fear, which it often is for a lot of us. Mary's theory is that George is afraid of the stranger coming into their house, and the anticipation of this moment makes him agitated. The doorbell and the dog barking just worsens the situation. So Mary's now at step 3. What can she do about that? Weighing the pros and cons. What are some possible solutions to this situation? She thinks she has a pretty good idea of what's going on. What can she do about it? So part of the solutions that can work for any situation, potentially, or some of the things you want to consider are identifying the stressor, and Mary certainly did that, dog barking, buzzer, stranger. Looking if there's a comfort and pain issue, maybe not so much comfort, pain, but there might be hunger at play in this situation. Focusing on the feelings, and she's feeling pretty strongly that while, the lashing out looks like anger, that George is scared. Distracting is often a way to move people away from the problematic situation. Being positive despite what's happening. Limiting stimulation. So, again, dogs barking, buzzers going, that might just be too much for George. Providing space and giving the person relaxing activities to do if there's a challenging situation. Little note at the bottom, don't argue. And that's always that sort of two things that are important when we're talking about communication with a person with dementia. Don't argue, don't take it personally. And those are they make so much sense here. They're a lot harder to implement here. They hit us where we live, and often it's very easy to slip into that arguing and taking things personally, even when we know better. So Mary wants to remove or minimize the stressors in this situation. So one of the things she does just before it's time for the meal to be delivered is put the dog in the bedroom, so that if the dog is barking, it's not right out there where it's so loud for George. She will ask the delivery person to use his cell phone instead of the doorbell. So she'll, get a little buzz on her phone that, he's coming up the driveway. And ensuring that he stays on the porch instead of coming into the house. So she gets the little buzz on the phone. She knows he's coming up the driveway. The dog might be barking, but it's in another room with the door closed. Mary goes to the door and meets him on the porch and gets the meal. That's a huge big piece that she's looked at handling. In terms of relaxation, Wheel of Fortune, that's his show, that's George's show. So maybe she'll tape a few episodes and pop them in the VCR and say something like, why don't you watch Wheel of Fortune while I get lunch going, so that he's distracted and relaxed, hopefully. Reassuring. Mary will explain to George that if he notices her going to the door, she's getting the meals, but she won't let the delivery person into the house. So on the assumption that it's scary for George to have this stranger in the house, she's reassuring them, I'm just going to the door and I'll get the meals and that's it. Now, relaxing activities, Mary chose to use a tape of Wheel of Fortune. What relaxes one person will not necessarily relax another. And there's all sorts of possibilities that you could look at if you were trying to put some relaxing activities in place to help the situation. Soothing music. And again, what is soothing music to one person is not going to be soothing to another. So knowing the person, what kind of music do they like? What helps them? Dancing, if there's some music they like and they are comfortable just kind of dancing around while you go get the meal, for example, in this situation. Or in a different situation, having a little twirl around the room for a few minutes just to help calm the person. Outdoor walks, gardening, creative activities, whatever they might be, reminiscing, holding hands, just sitting together. There's lots of activities that are relaxing. Now, obviously not all of these activities, even if they all worked for George, not all of them would be useful in that particular situation that we're talking about. But they would be things that Mary could call on if there were problems at another time. So if, for example, he got agitated when they went to the doctor, she may find that just sitting, holding, and stroking his hand might make a difference. So, adapting to the situation. So then we get to step 4, and that's, do it. Implement the solution that you thought of. Develop their plan. Make sure you know how you're going to do it. And then, decide if it helped or not. And usually when you're talking about making changes in process with a person with dementia, sometimes, as I mentioned earlier, something will work really well today, it won't work tomorrow. Or you might try it the first time and it doesn't have resounding success. That doesn't mean you shouldn't try it a second time. A lot depends on how the person feels at that moment. And it might be absolutely the greatest thing to do tomorrow. So in Mary's case, developing the plan. So she phones the meal delivery service, explains the situation. She decides what time she'll put the dog in the other room and get the VCR set up. So if the meals are always delivered at 12:10, maybe by 12 o'clock she's going to make sure that the dog's in the bedroom and the VCR is on. Setting the VCR, putting the dog in the bedroom, seeing if he barks when the front door opens. If he does bark and it's still really loud, maybe in the basement might be a better plan. So she's checking all these things out. And then evaluating, trying it out. And how did George react? Did he still get really tense and upset? Was he a little better? Was he worse? Potentially. Maybe she's got it all wrong and her assessment of the situation is totally off. But was it better? Was George able to relax while watching Wheel of Fortune? He maybe loves Wheel of Fortune, but as a means of relaxing him when it's tense, maybe it really doesn't cut it. And adjusting. If it turns out that it wasn't effective in relaxing George, she might try to ask George to set the table while she goes to the door. Or she might put some music on instead, or ask him if he will dig some weeds in the backyard for 10 minutes just before lunch. Whatever strategies might help. If the voice of the delivery person made George tense, Mary could adjust the plan a little bit more and meet the van, the truck on the driveway to pick up the food. So she gets the call and she goes outside to pick up the food. That might help. In terms of the future, with time, and as George gets more relaxed with the situation, Mary might ask him to come to the door and say hi to the delivery person. This might help transform a negative situation into a positive one. It might backfire, and he might get very tense seeing the person. But again, that's all part of that adjust, adapt, tweak, see what works best now. Now, in any of these kinds of situations, safety is crucial. And safety in at least two aspects. One is safety for the person. So if the person is lashing out, particularly if they're lashing out physically, then it's important that the physical space around them is safe so that they are not likely to hurt themselves when they're doing it. And this requires sometimes some advanced planning. If it's happened a couple of times, a few times, and it looks like this is something that is not going to be rare, then really taking a critical eye, looking at the situation and seeing, if John gets like that, what can I do? Is there something I can do so that he won't hurt himself when he's like that? But there's also safety for you as the caregiver. And when you're caring for someone with dementia, often that need to care all the time is so overwhelming that people will put their own safety at risk as a result of this. I'm afraid he'll hurt himself. I'm afraid he'll fall. If he ends up hitting me, well, that's okay. I can handle it. No. Maybe the first hit didn't hurt you, but at some point it might hurt you, and at the very least it's hurting you in other ways. And so leaving the room as needed, asking for assistance. And that can be really hard because when the person is lashing out like this, particularly if it's not the way they've always been, it can be so embarrassing. And it shouldn't be, but it can be. And so letting people know what's happening can be so embarrassing. My husband pushed me when I tried to get his lunch organized today. And as with anybody who is on the receiving end of any physical actions from someone, it can be embarrassing in this situation. And again, this is not something I'm saying you should be embarrassed at all. But the fact is some people are. And so they would minimize it. And, the kids call and say, how are things? And, oh, pretty good. Dad's he's a little restless, but pretty good. And then the kids come over for Sunday dinner and they notice huge bruises on Mom's arm. What's going on, Mom? Oh, I banged into that stupid cupboard in the bathroom again. Rather than being honest about what's happening and getting some help. Letting the next door neighbor know if you have any kind of a relationship with the neighbor. John's been acting a little not like himself lately, and there might be times when I might have to come over and just ask if I can stay here for a few minutes until he calms down. Is that okay? So, letting them know, explaining what's happening. Looking after yourself. This is trite almost. It's used so much as an example. But we always look at, what do they tell you on the plane? If the air pressure in the cabin changes, the mask will fall down. Please ensure you put your own mask on before helping a child or dependent person with you. The reason, you can't help them if you can't breathe. You've got to be able to breathe yourself before you can care for this child or a dependent adult that's with you. But often when we're caring for somebody with dementia, we are the last ones we look after. People that are in a caregiving role will often be very, very sick before they ever see a doctor because, things are coming up and, well, I'll go to the doctor when I have time. I'm too busy right now. Or, John, I'm too busy with John. John's got too much going on. I don't have time to go to the doctor right now. I'll go later. And later and later, and later doesn't come. And the problem is if you're not caring for yourself, well, obviously if you're not caring for yourself, you might get seriously sick. But even if you don't get seriously sick, at the very least, you may get very raw and easily irritated, easily annoyed, less patience, and it backfires because you're in a situation where you need as much patience as you can possibly muster. But it's so hard to have it if your needs are put on the back burner all the time. So finding support. And sometimes that support is a good friend. Sometimes that support is coming to the Alzheimer's Society and seeing about a support group, or talking to one of our support and education coordinators, or getting some education so that you have support in terms of knowledge. We also have if you're in a situation where it's really difficult for you to get out, to go to, for example, a support group or an appointment with a support and education coordinator, we do have a telephone support group. And so that's a way that you can talk to people. And I got the group started, probably about 3-4 years ago. And when we first tried it, it was just a pilot. We were checking to see how it would fly. And I really didn't think that there would be a huge level of intimacy with the members of the group, a great level of connection with the group members because they never saw each other, they didn't know what they looked like. They could end up sitting beside them on the bus, each other on the bus, and would not know. And yet the degree of intimacy and support in this group astonished me. And so you can still get that support in a way like this, even if you can't do it in person. Take time to unwind, and sometimes that means that you need to solicit paid help. If there isn't family help or friends that can help you out, a little bit at least of paid help so you have a bit of time for yourself. Sharing your feelings. Some of the feelings that go along with being a caregiver are not necessarily ones we're proud of. When things get very difficult, we may have feelings that afterwards we think, what an awful person I am, that I felt that, or that I thought that. Talking to other people in a similar situation can be very reassuring because you discover that you really aren't the only one, and that it's normal, and that it doesn't make you a bad person. It means that you're a person who's dealing with a big issue, and it's hard. Taking regular breaks, even if you can do it a little bit during the day, for some people, just that 5 or 10 minute soak in the bathtub, even that is just enough to just pull back a bit. Studies have shown actually when caregivers even just take a minute or two to pull back from tough situations and do those deep breathing exercises. So it's breathing deep in through your nose, holding it for a second, and then letting the breath out through your mouth. Even just doing that a few times a day, you don't need to leave the person you're caring for to do that. All you need to do is disengage for a couple of minutes. In through your nose, deep breath, hold it out through your mouth, and try and get it all out. If your brain is getting sufficient oxygen supply, it can calm you. And just even something like that can make a huge, big difference in a person's ability to cope. Remember, it's not personal. And again, that's something that you can probably remember up here. But when the nasty words are being thrown in your direction, and I hate you, and you're not my wife anyway, I don't know where my wife is, and you are his wife, that can hurt a lot. It's the disease, it's the disease, it's the disease. And that can be a hard thing to really, truly accept with your heart. I also just want to mention, before I run through the resources from the Alzheimer's Society and open this up for comments, and that is, when we're talking about understanding behavior, and we're looking at, admittedly, behaviors that are not fun. We're looking at the throwing things, the yelling, the hitting. Those are behaviors that they're difficult for most of us to deal with. I don't want that to overshadow the fact that even if a person does act this way sometimes, that there's also those wonderful moments and those moments of grace in caregiving, those moments of humor, those moments of warmth, silliness, fun, and to never ever lose sight of the possibility of those, because you get one or two of those, and that can make some of the difficult ones so much easier to handle, because you've got that little glimmer. There was that time yesterday when your husband